if I could comment first, I'd say I'd like to know, is the problem, whether it's otitis or pharyngitis or cough, is it happening over and over again to suggest a chronic problem? And the first test I would do would be a CBC, a blood count with differential, to see if the white blood cell count total is very low. And the third thing I would do is I'd say, please help me to get a complete medical history in your family.
I agree with Dr. Dale. As a pediatrician, it might be sometimes a discovery, unsuspected discovery from a blood test of neutropenia or lymphopenia, even without symptoms, and then you have to investigate. If you see both, especially neutropenia, which is apparently very severe, you have below 200 cells, and the clinical manifestations are very mild. Especially if you see also lymphopenia, you have to suspect WHIM syndrome and then go for genetic testing of CXCR4. That is what I would do as pediatrician.
Yes, I agree both to Dr. Dale and Dr. Badolato that the CBC is a very, very important test. What I would like to add is to our allergist, immunologist colleagues in the audience is to always check the neutrophil count. We are focusing on lymphocytes. You have to check the neutrophil count and repeatedly check it. When both of them are abnormal, then you are beyond the typical antibody deficiency syndromes, and you really have to consider these unique entities such as WHIM syndrome. And we all know that Myelokathexis is a very important feature, but it's operator dependent and academic center dependent. So I agree with Dr. Badolato that going for an easy upfront genetic testing would be a very fast way of understanding whether the patient has WHIM syndrome. All of these panels are not covering the region that we are interested in. And these are very important steps in your critical thinking about the patient as an allergist, immunologist. Now, if you are a hematologist, I encourage you to look at the lymphocyte count and not to focus on the neutrophils alone, because I see a lot of our colleagues in hematology sort of not following the lymphocyte count age appropriately. So that would be very important for both of these specialties.